Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Injectafer Infusion, how long does it take and how often is it given? Key points. Injectafer is given into your vein as either as a slow intravenous, 4, push or as an 4 infusion that can take up to 15 minutes, but you'll be at the clinic for at least 45 minutes to an hour each time due to preparation, administration and observation. In general, you will receive 1 or 2 doses for your treatment course. After your injection is finished, your healthcare provider will watch you closely for about an extra 30 minutes to see if you have signs or symptoms of a serious allergic reaction. Injectafer is usually given in 2 doses at least 7 days apart for iron deficiency anemia. In some cases, your doctor may decide you can receive treatment as a single dose. For iron deficiency with mild to moderate heart failure, it is given as a single dose or 2 doses at least 6 weeks apart. Injectafer may need to be repeated if iron deficiency anemia, IDA, or iron deficiency with heart failure reoccurs. Your doctor may need to check your serum phosphate levels prior to a repeat course of treatment. You can eat as you normally would before your appointment unless your doctor told you otherwise. Recommended dosage for treatment of iron deficiency anemia. Iron deficiency anemia, IDA, is a type of anemia that can happen if you do not have enough iron in your body. This can lead to too few healthy red blood cells. It is the most common type of anemia. In patients weighing 50 kilograms, 110 pounds, or more, Injectafer can be given as 1 or 2 intravenous, 4 doses. If given in 2 doses, the recommended dose is 750 mg intravenously in 2 doses separated by at least 7 days for a total cumulative dose of 1,500 mg of iron per course. Alternatively, for adults weight 50 mg or more, it may be given as a single-dose treatment course of 15 mg/kg of body weight, not to exceed 1,000 mg, if approved by your healthcare provider. In patients weighing less than 50 kilograms, 110 pounds, the recommended dosage is Injectafer is 15 mg/kg body weight given intravenously, 4, in 2 doses separated by at least 7 days per course. Injectafer treatment may be repeated if iron deficiency anemia reoccurs. Recommended dosage in patients with iron deficiency with heart failure. Doses are based on weight and hemoglobin, HB, levels, see product label. On day 1, doses are either 500 mg or 1000 mg. At 6 weeks, an extra 500 mg or 1000 mg dose may or may not be needed based on hemoglobin level and weight category. A maintenance dose of 500 mg may be administered at 12, 24 and 36 weeks for certain patients based on serum ferritin levels and transferrin saturation value. There are no data available to guide dosing beyond 36 weeks or with HB 15 grams/day/L. Injectafer treatment may be repeated if iron deficiency in heart failure reoccurs. What is Injectafer approved for? Injectafer is approved to treat iron deficiency anemia, IDA, in adults and children 1 year of age and older who cannot tolerate or failed treatment with oral iron products. Adults who have chronic kidney disease who are not on dialysis, non-dialysis dependent chronic kidney disease. Iron deficiency in adult patients with heart failure and New York Heart Association Class 2/3, mild to moderate heart failure, to improve exercise capacity, improve the ability to exercise. Warnings with Injectafer include low blood phosphate, high blood pressure and severe allergies. Ask your doctor how to recognize these reactions. Tell your doctor if you see any signs or symptoms. Common side effects you might experience with Injectafer include nausea, high blood pressure, flushing, injection site reactions, skin redness, dizziness and low levels of phosphate in the blood. In children, the most common side effects are low levels of phosphate in the blood, injection site reactions, rash, headache, and vomiting. These are not all the possible side effects with Injectafer. Contact your doctor for any questions about side effects. Be sure to report any signs and symptoms of an allergic reaction that may develop during and after your Injectafer injection, such as a rash, itching, dizziness, lightheadedness, swelling and breathing problems. Injectafer, ferric carboxymaltose injection, is an injectable iron replacement product. It comes as a single-dose vial containing either 100 mg, 2 ml, 750 mg iron/15 ml or 1000 mg iron, 20 ml. Each milliliter of Injectafer contains 50 mg of elemental iron. It is manufactured by Daiichi Sankyo American RegentLearn more, Injectafer side effects, in more detail. These highlights do not include all the information needed to use Injectafer safely and effectively and does not replace your doctor directions. Review the full Injectafer information here, and discuss this information with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.